Arguing against getting sick south of the border begins not with medical statistics, but rather by comparing bankruptcies in our two countries. Americans are nearly 3 times as likely to become bankrupt as Canadians, and the reason is medical bankruptcy. David Himmelstein wrote in the American Journal of Medicine in 2009 that 62% of American bankrupts were caused by inability to pay medical bills. Surprisingly, he found that 3/4 of medical debtors had health insurance that proved inadequate to pay the bills in the face of a serious illness. Now, nearly all medical statistics show better health outcomes in Canada. Johns Hopkins is an esteemed medical university in Baltimore. Their statisticians have compared national health results in our two countries using Organization for Economic Cooperation and Development data. Life expectancy and infant mortality are, of course, better in Canada. Healthcare costs 60% more in the United States, and according to Johns Hopkins, Canadian patients live longer after cancer, heart disease, stroke, diabetes, and lung disease. Furthermore, the Hopkins team found the chance of dying from a medical error in an American hospital is 50% greater than a Canadian hospital. So, if you get sick and you choose to go to the United States, you die sooner, you have a higher risk of fatal medical error, you pay at least 50% more, and if you are sick enough, you go bankrupt. However, rather than relying on statistics, let me tell you why this surgeon would rather look after sick patients in our system rather than in America. I learned my specialty as a bone cancer surgeon at Harvard University and the Mass General Hospital, and what I saw there made me come home to Canada to stay. Looking after teenagers with bone cancer like Terry Fox in Boston was troubling. Black and Hispanic children frequently came to our clinic at a much later stage of disease, with large tumors that frequently required amputation rather than arm or leg salvaging surgery, or even after cancer had spread to their lungs. This demonstrated the poor health equity outcomes, evident even in Massachusetts, the most liberal state in the nation. This was also my first exposure to the inequity of American health insurance and health economics. Private insurance and health economics are the root of all evil in getting sick in America.